Hi, I'm Dr. Dan Shapiro. I'm a plastic surgeon certified by the American Board of Plastic Surgery. I've been performing cosmetic or aesthetic plastic surgery in the Scottsdale Paradise Valley area since 1992, and that's all I do. I just do cosmetic surgery. I do a lot of body contouring. I've gone down to Colombia a couple times to learn some very specific body contouring techniques. And I think the difference between good and great when you're talking about body contouring and the results that we get as surgeons are very apparent. I turn away a lot of people from liposuction. The reason being is that I don't like unpredictability, and I really want people to get their money's worth and to feel as though they look better than worse after the procedure. Liposuction is very technique dependent, and we've seen an evolution of the procedures over time. Whereas before, the cannulas that we take the fat with used to be much larger. They're very, very small now, and that accounts to much less rippling. So a common question that I have from patients is, Dr. Shapiro, why can you get rippling after liposuction, especially in the abdomen? And the reason being is that it tends to be technique dependent, and I'll tell you why. First of all, I think, as I said, when I turn away patients, I think that their skin is of not of sufficient quality to get the tightening that I want to showcase the contouring that I perform. So I never want to have anybody with extra skin, and I really, really don't like to have anybody with irregularity. The reason why that irregularity can happen is that either the skin doesn't have the elasticity to contract back, or when the procedure was done, it wasn't done in an even fashion. And I think that if there's any question about what should be done, I just don't do it. In the last year or two, I've adopted a technique called safe liposuction, that's S-A-F-E, that actually is a technique that takes your fat. When I'm doing the liposuction, I will pre-tunnel with a cannula that has a little basket on the end that tends to cause some tightening beneath the skin and equalize the fat departments. It makes the fat compartments much more even. I then perform liposuction, and then I go back with that same instrument, and I even out the fat compartments and I even out the skin. So that really results in much less chance of irregularity or rippling from the skin, and really promotes some skin tightening. So the answer to the question is, why does rippling happen after a liposuction of the abdomen? The general reason is either it shouldn't have been done on that patient with some skin tightening issues, or it probably was done in an uneven fashion. There are ways to fix that. You can either have the safe liposuction technique, you could have some ultrasonic liposuction to help decrease the irregularities right beneath the skin, and you could have some fat put in to help even out the area. But if you have some rippling from liposuction, the best way to figure out what can be done is come in for a consultation. I think it is very important that you understand that the abdomen is very unforgiving. Why? Because you look down and you see it all the time. So be very careful if you're having liposuction of the abdomen. Check out the surgeon that's performing it. Ask him what can be done. Ask him how often he sees it in his practice, and ask him how he would fix it. But I'm very happy that I see that very, very infrequently in my practice. Thank you.